Okay, today's Q&A question comes from Amanda, and she wants to know, she already went to physical therapy, massage, and chiropractic. It didn't work for her. She wants to know why it didn't work for her and what we would do differently that she already hasn't tried. So here is the reason why conventional physical therapy, chiropractic, and massage fails pretty much everybody. They do not know how to get to the root cause of your problem. So if you've been to conventional physical therapy, okay, so today's Q&A question comes from Amanda, and she wants to know why she's already been to physical therapy and massage and chiropractic. She wants to know why it didn't work and what we would do differently, if anything. So here's the reason why what she tried and what a lot of people try doesn't work. Conventional physical therapy, chiropractic, and massage don't know how to get to the root cause of your problem. All they know how to do is chase symptoms. So if you have been to previous physical therapy where they tried to reduce your pain, increase your range of motion, reduce your swelling, increase your strength, those are all symptoms. And when you attack symptoms and you don't get to the root cause, you can get symptoms to go away for a while. So most physical therapists, chiropractors, and massage therapists have people walk out of their clinic feeling better. The problem is about an hour later, all of those symptoms come back because if all you did was manipulate symptoms with dry needling, stretching, heat, ice, cupping, massage, lasers, electrical stimulation, all that does is override the pain response so you feel better even though you're not any better. Then if we look at what they're doing to try to increase your range of motion, so you can easily increase short-term range of motion by stretching and rolling and massaging. You can also do all of that stuff at home. You don't need to pay somebody to do that for you. You can have somebody at home do that. They'll do the exact same thing. The problem is when you artificially increase range of motion by forcing muscles to relax, those muscles eventually start to get tight again, and then you have to go through the whole process again. So here's what's different, Amanda, that we would do here. First, we would do a functional screen because what we care about is getting to the root cause of your functional limitations. I don't want to know what your pain rating is from 0 to 10. I don't want to know where your pain is. I'm not going to worry about swelling. I'm not going to worry about your diagnostic imaging, MRIs, x-rays, all that kind of stuff, because all that does is send people down the road to symptom modification. What I want to know is what can't you do and what position you're in when you have the symptoms. So just telling me that your back hurts here doesn't tell me anything. What does tell me something is when I have you do a single leg squat and you say, oh, when I'm going down at this angle, that's what hurts my back. Because then I can say, okay, I know what muscles should be working there, which means they must not be working. Then what we're gonna do is go break you down muscle by muscle to find out if those muscles are actually engaging, which we're gonna find out that some of them are not. Then the key is, that's the root cause of the problem. The key is we're going to reverse the root cause of the problem with our patented techniques, and then we're going to reassess you to make sure that when you do that little test that we did before and you're in that same position going the same direction, now that pain is no longer there. And guess what? We probably never did anything to that spot that hurt because that spot is not the problem. So if you're chasing symptoms like pain, swelling, instability, lack of range of motion at the spot of the symptom, you're probably going down the wrong road, and you will get some short-term symptom relief, but you're not going to get long-term functional gains, which is what we are all about here. So to answer your question in a short answer, the problem is when you went to the chiropractor, they didn't get to the root cause. When you went to the massage therapist, they made you feel better by covering up symptoms. When you went to physical therapy, they did nothing but modify symptoms and give you things to do at home to modify symptoms. None of those three clinicians got to the root cause of your problem. And if you don't get to the root cause, you can't reverse the root cause. And if you don't do that, you can't keep symptoms from coming back. So Amanda, to address your question about what would we do different, we would do everything different, because my bet is they also gave you things to do at home like stretching and rolling and taping and things like that, which don't help your problem. So what we're gonna do is we're gonna fix your problem here, then we're gonna give you things to do at home to maintain what we did here, so when you come back for your second visit, you're better than you were before. We're not doing yo-yo back and forth and having you come back 2 to 3 times a week for 6 to 8 weeks. We're having you come back 2 to 3 times. You are getting better in between that, in between those visits. You're going back to doing what you want to be doing. So, long answer for a short question, but the take-home message is you haven't tried 180 because you haven't been here, and we're the only ones that do it because it's our patented techniques. So what I would say is call, schedule a free consultation. We'll show you what we would do differently. You'll experience it firsthand, and then you can make an educated decision as to, are we doing something completely different than what you've tried before? And are you getting immediate and lasting results?